The coronavirus is an infection that can happen from a particular type of virus that was first identified in China. For a lot of people, it only causes mild illness, but for certain people that have medical conditions or in the elderly, it can result in significant conditions like pneumonia. We think it's usually spread through close contact. Let's say that you sneeze and there's some virus in your secretions, like your saliva or just like your mucus. That could get into contact with someone and get them sick. Or you sneeze into your hand and you touch a hard surface and someone touches that hard surface and spreads it to themselves by accident. It's actually a moving target in terms of research, and they think that it depends on the type of surface, but it can be as long as several days, according to some research. Actually, it does not. We do not think that it's transmitted through cooked food, unless the person who handled it and was like spreading their secretions around, like touched the wrapper and then you touched the wrapper or something like that. But well-cooked food, we do not believe that's the reason why people are catching it right now. So simple things like frequent hand washing, make sure that you clean off germs that are on your hand is extremely helpful. Right now we're recommending what we call social distancing. Probably the better term is just more physical distancing from people, avoiding close contact. What we mean by that is like reducing people's distances of less than 6 feet. Try to avoid being out in a crowd. Really only go out right now if you have to do the essentials, basically. The use of face masks is recommended for folks who are actively sick. That helps prevent getting other people sick because it kind of catches your secretions. However, the CDC is not currently recommending that people wear a mask to protect themselves. As long as you are well and you have no fever or known contacts with someone with COVID-19 or coronavirus, we think it is safe to donate plasma or blood. We think the highest risk are those above the age of 60 and those with underlying medical conditions. That includes things like hypertension, diabetes. We think that a lot of children probably don't show major signs of coronavirus or COVID-19. Generally, it's probably like a common cold that they typically have, the sniffles. Some of them may not even realize they have it. I think one thing to keep in mind is general preparedness is great. So let's say that it's time to fill your medications. Fill them now. Don't wait for them to run out where you have to end up in the ER to get them filled. Another thing is be prepared where some of the supermarkets may be closed down for cleaning and things like that. So make a disaster kit. Have 3 days worth of supplies in your home. If you weren't able to leave the home in 3 days, make sure you have enough on hand to take care of yourself. It's a great question. I honestly think that soap and water is best when it's available. Hand sanitizer is convenient. It will kill coronavirus, but one is not better than the other. And honestly, there's plenty of soap and water out there. And I personally prefer soap and water when I'm washing my hands. The most common symptoms in most people that get only mild illness is like a cough, some body aches, fever. That's for minor illness. In the folks that have the major complications, they start having shortness of breath, difficulty breathing, they have a low oxygen level, and they may end up in the intensive care unit. So this is a great question. It's an active area of research. We do think that some mammals, so dogs, cats, potentially could catch coronavirus. And so if you're able to avoid having close contact with animals when you're sick, if you're sick with COVID-19, I would recommend it. So again, most people do not have severe consequences of COVID-19 or coronavirus. A lot of people will, after a couple of days, they'll be fine. So our general recommendation is to go ahead and call your doctor. Don't go to the doctor's office. Call your doctor, ask for some advice. There are some medical systems out there that have an app or a hotline that you can ask questions about to see whether or not you need to be seen. And that would be the first step. Now, if you're having shortness of breath, you feel like you're about to pass out, you have chest pain, I would call 911 in those situations.